as we wrap up October and Breast Cancer Awareness Month, it's a good reminder to know who should be getting a mammogram, what the process of a mammogram looks like, and why it's important. Joining me this morning with more is Dr. Lindsay Jader and Val Carlson with Sanford. Thanks for being here.
Thank you.
All right, so we're kind of wrapping up October. Talk about kind of just the month of awareness and why it's so important.
Yeah, breast cancer is one of the highest, rates of, cause of death of women in general. And so it's important to get screened so that we can detect cancer in its earlier stages and get treated and save lives.
Yeah, and when does that kind of start? When should you be doing that?
So there are a lot of different organizations that have different recommendations, but the overall general consensus and what the American College of Radiology recommends is average risk women start getting screened at age 40 and then get a mammogram every year after that. Higher risk women might need to start earlier, but that's a conversation you should have with your provider.
Yeah, and talk about when you're looking to do that. People maybe have a little bit of fear about that or anxiety. Talk a little bit about the process of it.
Of just getting a mammogram?
Yeah,
okay.
And just, how it's not as hard as maybe people think, or maybe if they've never gone in yet.
Yep.
Okay, so when you present for a screening mammogram, I would have you first change out of your top and bra. I'll give you a gown to cover up, and then we'll go into the mammogram room. I will position the breast on our machine. It's a firm platform. I bring down a firm plexiglass paddle onto the breast and do a little compression. The compression is real important because that makes for a clear image for a radiologist to interpret.
So it's really important. So it's not too daunting for people.
No, discomfort varies patient to patient, and most of our women do just fine.
And it can really help catch that early on as well.
Absolutely. Yep.
Talk a little bit about as well, if there's other things people can do, like self-exams or things like that they can do.
Yeah, absolutely. A self-exam is, one of the easiest things that women can do themselves. Just knowing your breast tissue, what's normal for you, and then being aware of anything that's changing or different, and bringing that to the attention of your provider so you can get it checked out if you need to.
And how often should you be doing that?
At least once a month. It recommend just the easiest thing to do is just in the shower, just feel. Sometimes you can feel like lying down, sometimes with your arms above your head, and just those different positions can give you a better feel for what your tissue feels like.
And you talk about that risk level. What are some of those determining factors for risk level and maybe people that may be at higher risk?
So a few of the main factors: if you have a first-degree relative who's had breast cancer, male or female. Another thing is if you have a strong maternal or paternal family history of breast cancer. A lot of women, a lot of people think it's just the mom's side, but it can actually be the dad's side. If there's a strong history there as well, it might increase your risk. If you've had, there are a few other things, a lot of other things actually, but if you've had radiation for lymphoma or something as a child, that can increase your risk as well.
And then when they hit that age where they're getting checked, how often should they be doing checks with mammograms?
So once a year is what we recommend. So you get a screening mammogram once a year. If you're at a higher risk, you might have supplemental screenings with MRI or other imaging modalities, but mammography is what we recommend every year for women 40 and older.
Awesome. Well, thank you so much for being here, ladies, and sharing a little bit about this.
Yeah.